Now, we're more than 6 months into this pandemic. We want to do a check-in here. Let's bring in Allison Croft with this. And Allison, experts have learned a lot over the last 6 months, but there are still questions that are going to take some time to answer.
Yeah, two doctors held a discussion about what we know so far, what we're dealing with now, and what questions still need to be answered. So they say we've learned a lot since we found out this was even a problem in December of 2019. How coronavirus is spread, where it spread more easily, like bars, indoor activities, or constrained workplaces. There are testing options available now, and what things work to control the spread, like social distancing and masks. But they say our trends are slowly reversing, not in the positive direction, with 27 states seeing a rise in cases and 200,000 deaths in the country.
There's also some modeling out more recently that suggests that by the end of the year, we could actually be close to 300,000. And I think that's not at all unfathomable given the progression of this pandemic. We'll also soon hit 7 million cases in the United States.
They say the challenges we're facing include shortages of PPE in hospitals, shortages of testing kits, and provider fatigue. Remember, frontline workers in hospitals, they're still working. They continue to be exposed and they're exhausted, and it's not over yet. But they say an enormous challenge is the issue of masking.
So if I could turn the clock back, and I wish I had one piece of data, back in January, February, March, it would have been routine masking with standard medical masks, face covers, and similar.
Doctors say there's still a lot to learn. Moving forward, the biggest questions are, of course, about a vaccine and its effectiveness and how it's going to roll out. But there are also questions about the long-term effects of this virus. Both of those questions won't have answers in the near future, but as this pandemic continues.